60 Minutes Overtime.
This week on 60 Minutes, we report on an experimental therapy to treat COVID-19 patients. It's called convalescent plasma therapy. Most people with COVID-19 produce antibodies that help fight the disease. The antibodies from donors who have recovered from COVID-19 are collected in plasma, the liquid part of blood, and given to patients who are still fighting to survive.
When a person gets sick from a virus, there are a couple of defenses that the immune system has. There's the immediate defense, and then there's a vacuum until the adaptive immune system can make very specific soldiers against the virus. It was during that window that instead of waiting for that patient's immune system to have kicked in, we can go ahead and give them antibodies from somebody who has already made them, who has already recovered.
All right. Mwah. All right, you're going to do good, okay? All right, you hang in there, okay?
Medical oncologist Michelle Donato is the principal investigator of the therapeutic study at Hackensack University Medical Center in New Jersey. She told us potential donors must have previously tested positive for COVID-19 and been symptom-free for at least 2 weeks.
We know they had COVID, and there's a much higher chance that we will find antibodies in those patients.
Who makes the perfect donor?
So we want donors who have a high level of antibodies and antibodies targeting the specific virus.
Is it as simple as someone who was really sick and recovered would have a higher concentration of these antibodies that you're looking for?
I have not seen that yet with the donors that we have screened. Right at this juncture, I can't tell you that the sicker you were, the more antibodies you have.
How many donors are you looking for?
For now, I would say as many as we can find. What's interesting about plasma, it's the reverse of blood. You know how blood type O is the universal blood donor? But for plasma, it's really AB. So AB is the universal plasma donor.
As part of a national study with different qualifications and criteria, 60 Minutes senior producer Matt Polivoy has donated his own plasma. Matt became sick with COVID-19 in March.
I was one of the first patients at my local community hospital, Brooklyn Methodist, to be admitted with laboratory-confirmed COVID-19. The experience of being sick with COVID and being in the hospital was a real range of emotions. It almost felt a bit like a roller coaster. At first, the hospital was eerily quiet, but as the week went on, things got progressively scarier in the hospital. And they were telling me that the hospital was quickly filling up with other COVID patients, both suspected and confirmed. And the level of coughing that I heard was pretty terrifying.
After 10 days in the hospital, Matt recovered. He later took an antibody test and learned he was eligible to donate his plasma.
What I was surprised to experience was that it was actually a fairly easy experience, with one exception being the size of the needle that they need to put into your vein, because the needle is both delivering saline to keep you hydrated, as well as taking and removing blood, which contains the plasma. It's pretty seamless. So the plasma process, it's constantly transporting your blood into a machine, and it's spinning your blood and separating the plasma out of it, and then actually returning your blood back to your vein. So you're really only giving a very small amount of volume that's taken out of your body. As long as you can sit still for 45 minutes to an hour, which as a constant fidgeter, that's not exactly the easiest thing for me. But it's a really painless process. I've now donated plasma at the New York Blood Center 4 times. I have my 5th appointment scheduled for next week. Donating plasma is life-affirming. It feels amazing.
There's not only a need for plasma, hospitals around the country also need blood. COVID-19 has canceled most blood drives, and blood banks around the country are facing shortages. To learn how to donate your blood or to see if you are eligible for plasma donation, go to 60minutes.com/coronavirus.